lovely people. Welcome once again to another episode on Health Talk with Fifi. With me, Adjoa Duma Answer. Thank you so much for liking and sharing our videos. Make sure you subscribe to our YouTube channel at Health Talk with Fifi and follow our social media handles at Health Talk with Fifi. Today we are looking at erectile dysfunction. Before we get into today's video, let's take a look at what we did the last time and we'll be right back. Today we are talking about ways to manage common cold. First of all, never take an antibiotic to cure common cold because common cold most of the times are caused by viruses, and taking an antibiotic to cure a viral infection is a no-no. But rather, adapt to some home remedies like staying hydrated, drinking plenty water, fluid, juice, or sipping warm liquids. You can also have enough rest. Adjust the room temperature and humidity. Then you soothe a sore throat by dissolving a tablespoon of salt in a warm glass of water and sipping it. Now let's look at what erectile dysfunction is. ED, as we surely or we simply call it. So erectile dysfunction is the trouble of attaining and sustaining an erection for sexual satisfaction. So 25% of the time, the penis don't get firm enough. When it gets firm too, it gets soft soon, or it softens very soon. So that is what we call the erectile dysfunction. And this can be as a result of stress, relationship problems, a side effect of a medication or a health condition. But the main reason or the main cause for erectile dysfunction is insufficient blood supply to the penis as a result of clogged arteries. So your arteries are clogged, which is preventing blood from reaching the penis. And you know, for a successful erection, there has to be blood. So when blood is not being able to supply to the penis, there wouldn't be any erection. That is what we term as erectile dysfunction. So as I mentioned earlier on, that it can be as a result of stress or health condition, but there are some diseases or health conditions that contribute to having ED or erectile dysfunction. So we have diabetes mellitus, hypertension, stress, anxiety, depression, alcoholism. Then we have hypogonadism. So hypogonadism is whereby there is a low level of male hormone, that is the testosterone. There is a low level of male hormone testosterone in the person. So that person can have an erectile dysfunction if your hormone levels are low. That is the men. Then you also have multiple sclerosis and stroke, and many other more that can attribute to erectile dysfunction. So when it happens, that there are tips or ways to manage it. So you have to start walking, like exercise very well. Taking a walk every 30 minutes in the morning or in the evening can help. It can really help in the circulation. Eat well. Manage your diet. Eat vegetables. Eat balanced diet. And avoid the junk foods, the high dietary foods, sugary foods. And also you pay attention to your vascular health. You keep on checking your blood pressure each day to monitor it. Make sure you do lipid test to check that you are not in line with a coronary disease or heart disease, which can be as a result or which can cause you to have an erectile dysfunction. So you make sure that your vascular health is very important to you. Then you check your weight. Of course, obesity can also contribute to you having erectile dysfunction. So you check your weight as well. So this is the end of the video. We've looked at erectile dysfunction, what it is. We've looked at its causes and some tips to manage. Thank you so much for staying with us on today's video, and I hope you've learned a lot on erectile dysfunction. See you next time, same time, same day. Bye. Have a good day.